Hi everybody. The sciatic nerve is the largest nerve of the body. It is a combination of nerve roots from the lumbar spine and the sacrum. It makes this huge nerve here that goes all the way down to your toes. Now sciatica and sciatic nerve pain are a little bit different, but they can have similar symptoms. Sciatica, which is a true entrapment of the nerve root in the spine, will give you pain all the way down, sometimes to the toes. But the sciatic nerve can be entrapped in other areas. It can be irritated by muscles in the glutes, in the back, or anywhere down along the length. Depending on where that nerve is being interfaced with, you're going to have a little bit different symptoms. Over here, if we look at this chart, we can see pain down the leg in these charts down here based on which muscle is affecting the sciatic nerve or another nerve. So when I am treating people, I like to figure out, is it true sciatica? And sometimes I have MRI reports to let me know that they have some disc stuff going on, or just on physical examination, we can determine if the complaint is truly nerve related from the back, or if I can poke and prod and find out where I can reproduce symptoms, I can find out which muscles are involved. Now typically in my practice, whether it is sciatica from the nerve root or just entrapment of the sciatic nerve along the way, I usually use acupuncture. There's a line of meridians along the spine called the Wato Jaji that stands for Dr. Jaji's extra special magic points. Easy translation. And what they do is they treat the areas of the nerve root where it exits the spine. There's another line or a meridian just outside the Wato Jaji called the UB meridian, the urinary bladder meridian. And there are points along there that will also treat the local area in the back, affect the nerve, as well as release the muscles and inflammation that are irritated here. Another meridian that is super important for sciatica or sciatic nerve pain is the gallbladder meridian. There's a couple great points right in the glute region that will affect the piriformis. Now the piriformis, which is the muscle that turns our leg out, sits right on top of the sciatic nerve. And actually in 10% of the population, the sciatic nerve passes through the piriformis. So if the piriformis is getting tight, you cross your leg too much, you sit on your foot, anything where you're turning the hip out will cause this to be tight. You can entrap that sciatic nerve and inflame it, and that'll give you symptoms all the way down into the calf and sometimes into the foot. So by using those Wato points and that UB meridian and that GB meridian, as well as some UB and GB points down here, I can really affect the length of the sciatic nerve. In conjunction with that, as far as mapping and filling out what's going on with the particular person, we will add other points necessary for your particular complaint. So if you're having sciatica or sciatic nerve pain, something you can do for yourself is a tennis ball. You can use a tennis ball to release some of the muscles in the hip, some of the muscles in the glute, and if you're releasing those points, what you can get is you can get relief on your symptoms, especially if it's entrapment of the nerve and not necessarily true sciatica from like a disc herniation or entrapment. Another thing is to open up your hips, so some simple stretches to relax those muscles are important, but also it's really good to have some work done in your low back and in the hip region, and by releasing a lot of that muscular component and getting the inflammation under control, you can take a lot of that pain down the leg away. Most individuals that I see in my practice that are complaining of sciatica aren't the disc candidates. They're more of the superficial, repetitive sitting motions, irritation, inflammation of the muscles. So through the acupuncture, releasing those meridian lines and getting those muscles to open up and get the inflammation out, I get a lot of response and get a lot of pain out of the leg. When you start working on your own, what you might find is that the leg pain starts to go away, but you're a little irritated in the back. That's called centralization, and that's actually really good. That lets us know that you're addressing the part of the body that's actually creating the referral of the pain, and you're taking that and you're getting it healthier. But because you're poking it and you're touching it or you're stretching it, those muscles can get a little irritated. But the pressure's coming off the nervous system, the noxious acids that are built up in the muscle aren't inflaming the nerve anymore, and you're going to get a lot of significant relief. So I hope you enjoyed what I had to say today. If you have any questions, comments, concerns, please leave them in the comments below, and we'll catch you next Friday.